Hi everyone, this is Anne and I hope I am seen well and that the audio is good because I'm just gonna record this with my camera. I'm not gonna set anything up because I was not really planning to make another update video, but I thought let's do one before I give birth because Friday I am 37 weeks pregnant. So an average pregnancy is like 40 weeks, so you can give birth earlier or later. So we'll see when that happens. I just wanted to do a little update since some people have been asking. And I hope the audio is loud enough because I'm not using any specific mics. So yeah, we'll see about that. So basically, I gotta make sure I don't talk too fast because I tend to talk really fast and get out of breath. And I already breathe like harder when I'm pregnant. I have the same with Sophia. It's very like common for pregnant women to like, you hear breathing more and it's like heavier, sort of like you hear the breaths more. It's like your mucous membranes, they swell up, and I have that both times now and with Sophia. So first of all, I guess you want to see the bump. I know I always want to see that, you know. I've already eaten, so I'm just gonna show you. This is my 37 weeks bump. Like this. Gonna try go on the bed a bit further. So very similar than with Sophia. I have not gained much weight. I gained around 9 to 10 kilos, I think. With Sophia I actually gained 14 kilos, but I had more water weight with her. So far I don't have any water weight much, maybe a little bit on my face, I don't know. My fingers, nothing, can still wear my rings and stuff. Yeah, no stretch marks of course. Didn't have that with Sophia. That's from my pants, from being tight. But I really don't expect to have any now either, because the bump and everything is kind of similar. The baby is bigger than Sophia because it's a boy, but he is, for his growth, his body, he is a little bit taller than average, but he's slender, but his head, oh my god, and that's the thing I'm worrying about, like his head. Sophia's head was really big up until a certain point, and then it started dropping to a normal 34 centimeters, which is maybe a little above average for a baby girl, I don't know. But his head, I don't know when it was, but it was always like over 99%. And now it was again over 99%. Like he was like 3 weeks, his head is now like 3 weeks in advance. Before this it was 92%. And then before that it was again over 99%, but 4 weeks in advance. So it kind of is going up and down. So I hope with this ultrasound now that it's gone down again. Because I'm scared of like birthing a big like headed baby. With Sophia it was no issue. She was 34 centimeters and sorry. She was like, I was pushing, I had pushed really shortly. Like my labor was super fast, like 4 hours, and I pushed for like maybe 10 minutes. But the last push, they took the venous extractor and put it on her head to help pull her out, because whenever I pushed, her heartbeat would do really weird things because of the pressure. I don't know where, maybe on the umbilical cord or something, but they wanted to take no risks, so the doctor was like, I'm gonna put her on a venous and help her pull her out fast. And normally that increases your risk of tearing. A fast birth increases your risk of tearing, lying on your back, and the venous extraction. I had all three, and I had a first degree tear, very minimal on my perineum, didn't really feel it because the contractions are just too painful, and the crowning, and you don't really notice it separately tearing, just pain whenever you're just in pain anyway. So I think I will be fine with this one, even if the head is big, because even with all those things with Sophia and her having even a 34 centimeter head, I barely tore. And my doctor also said, I said to her, oh god, I'm worried, like what if he has a huge head? But she said like, oh don't worry, it will be fine. So I'm kind of trusting her. I'm doing perineal massage also, which kind of hurts. They say like online, some people say it should hurt because you're like stretching down there, like you're feeling. others say it shouldn't hurt, but yes, it does hurt. Like you have to put your thumb in your vagina, and then you have to press along the bottom and kind of massage the area and rub it and like stretch it against. I can only do it with one hand. Like I can't do it with two hands, it's uncomfortable. I always do it with my one hand. I put perineal massage oil on it, and then I just press it. It's really hard. Like you should think it was like soft and down there, but it's like really hard. You can feel the muscle, and like it's hard to stretch that area just naturally for yourself. I find maybe more the sides is easier, but like my perineum is also short. I have a short perineum. I cannot just grab it like that and start massaging. Like I don't know, maybe some people have this huge area there and they can like, maybe it's softer for some people. I don't know if you have experience. And is this normal? Is this not normal? Anyway, I have not have issues there or anything, so I'm just doing that again to prevent tearing, because that's just something. Maybe this is my second child, so they say second child is like less chance of actually tearing, so that's what I hope. For the rest, I really have no complaints. Like with Sophia, my pregnancy has been easy. We have just moved, so I have been painting. I'm still painting the entire house. I'm packing, I'm putting up furniture. Yeah, I'm just very lucky to not have any symptoms, because I'm on mommy groups and I constantly read about women there who are on bed rest, or they have to take it easy, or they have like pelvic this how is it called, pelvic instability and stuff like that. So I think I'm really lucky to not have any of those symptoms, and still, because I would feel so annoyed if I couldn't do, like we just moved and there's so much to do, like it would annoy me if I cannot get it done, you know, because it needs to be done and I just want to get it over with. I pre-recorded a ton of videos for my maternity leave, so for 3 months I'll be uploading pre-recorded videos, no problem, so I can just focus on the baby. After that I have to start recording again, of course. What else? For the rest, it's like I feel my boobs are a little bit bigger than last time, because I've already breastfed for like 19 months, and I feel like my boobs now have grown faster and more than with Sophia. I have naturally small boobs, but now they're like, I have to get a whole other cup size and stuff like that. But my boobs never changed from pregnancy and breastfeeding. Some people, like they say their boobs have like they dropped, or like they become like empty tea bags. But with me they were like, they started like, I stopped breastfeeding, well Sophia stopped actually, and then they returned to normal. They were small again and they did not droop. But if that would happen, honestly I would get like a mommy makeover and get my boobs like redone. Like I'm too young to live with like T-sagged boobs, and I would just feel more attractive myself, and also sexually for myself it's more arousing if my boobs are nice. I don't know, it's just like it's a thing for me. And also if I would have loose skin, like with Sophia I returned to completely, my body was like snatched back up after birth very fast, and I hope the same now, because I kind of look the same. My bump is pretty small. But if I would have that loose skin, some people are like, they post these things online, and I think it's admirable that they can embrace that and live with that for the rest of their life pretty much. And it looks like very old, wrinkly, hanging skin. But if I could do something about that, actually, I would. So if I would have that, which I doubt, of course, I think it will just snap back really well. But if I would have that, I think I would have something done about that. Because I think if you cannot accept it, and it keeps bugging you, and it's just gonna bug you all your fucking life, and it keeps being there, then I'd rather just do something about it, instead of having it in my mind and like worrying about it and this and that, and not feeling comfortable with myself. So yeah. What else? For the rest, yeah, just sucks with COVID, of course. Thankfully there's like fast tests now where we can do a fast test and I can still give birth in the birthing bot, because last time I went without epidural Kind of scary now with that big head. Maybe I'll get an epidural. Probably not, because they say your second labor is faster. If it's faster with Sophia, then it's gonna be really, really fast. So I hope I don't give birth in the car or some shit. And I was going too fast. At a certain point I wanted an epidural because the pain was, I had back labor and the contractions were so short on each other, so I wanted an epidural at a certain point, but I couldn't because I was going too fast and I was already 7 centimeters dilated, and the anesthesiologist was taking too long to get there, or he was doing something. So this time might be the same. So yeah, I was thinking about that also. Yeah, for the rest, I don't know, baby's doing fine. I have my next ultrasound Tuesday. Then I'm going back. It's always fun for me. In the end, it's every 2 weeks actually, so that's fun. Else it's like every month we get an ultrasound in Belgium. And the doctor will check me for opening inside, and always get regular blood tests also to see your blood clotting, your mineral, vitamin levels. They did this swab last time with a cotton swab in my vagina to test for the streptococcus bacteria, because if you have that you need to go on antibiotics. It can cause like something for your baby, but I didn't have it thankfully. Then also toxoplasmosis, other stuff, they test a whole bunch of stuff. But I really like all those things. Some people are like, oh, I don't want any extra I don't know, investigations or people touching me or checking me. I'm like, yeah, check me and do these things, because the more info I have about my body and what's going on, I just love that kind of stuff. I've always loved that kind of stuff. I would get like myself, like test my blood sugar and everything just to see like how am I doing, you know, what's the status status update. So yeah, I think that's it. With Sophia, everything is going perfectly. She's doing really, really well. She's very smart, speaking 2 languages, English and Dutch is what we've been speaking to her. She speaks in like little sentences and telling stories and stuff, and she's just 2 years old. She just turned 2 years old. The bell is going, hold on. Okay, so the mail just came. Is it zoomed in enough even? Yeah, it is. Okay, so basically I'm just gonna end it here. If you have questions, you can ask them. If I forgot some things to say, you can put them in the comment section and then I will try and answer them there. Yeah, that's it. Bye bye.